So thank you all for coming. This is the Echelon-Health Concierge Medicine private town hall. And the reason I did this was because we had several people asking about it. And we thought, why would be a better way to do it than to have a small little private event so we could answer any questions that people had about what is concierge medicine, because I oftentimes get answered or asked that question and then I'm kind of trying to explain it on the fly. So I thought it'd be good to take a time to have people just come in and meet with us and find out what we do. So the first thing I want to say is thank you all for coming. And also I wanted to say is I think that the important thing, that the reason why we're both here is so we can help each other understand what our needs are, both as a patient and as a physician. And I do concierge medicine only for my patients. It's the only reason I do it. For myself as well, but we are able to practice medicine that is more pure, I say, more like it used to be in the old days. And that's the reason I've done it. And that's the reason we do it. And that's the only reason we do it. We have no obligations to outside payers. Therefore, we have no other interest than those of our patients. So I want to give you a little bit of history about what I am and what I've done and how I got to where I am, and then we'll open up the floor for questions. My history is that I grew up in Florida. I grew up in Lakeland, and I went to school at the University of Florida, and then I went to school for medical school at the University of South Florida. Afterwards, I went to school, did training at Morton Plant Meese in Clearwater, Florida, which was a joint program with USF. And I studied family medicine, or I trained in family medicine. And very early on, I knew that there was no way I was going to be able to do family medicine the way it's supposed to be done. And what does that mean? That means that you see 30 patients a day, 40 patients a day, and then you're not able to really take the time to figure out what is actually wrong with the patient. And so that's the reason I chose to do family medicine, is so that, come on in. And the reason I chose to do family medicine is so that I could figure out what my patients need and do exactly what they need to have done without having any of the constraints of the time limits that are put on an insurance-based doctor. There's a lot of things that happen in medicine nowadays that has nothing to do with the physician, has nothing to do with their shortcomings. It only has to do with the pressure that's put on them by an artificial constraint that is due to the bureaucracy, essentially, of third-party payer system. And so that's why I did concierge medicine. So I studied family medicine, then I graduated, and I did one more year of sports medicine. So sports medicine, for what I do, is non-operative orthopedics. It's also specialized training, concussion, also heat illness, and things that are dealing with active individuals, whether they be professional athletes or not. And the reason I did that was to make myself a more well-rounded physician. That's the reason now when I have a concierge medicine patient join our practice, we can do about 98% of their medical care, take care of them definitively. So there is no wasted time sending them all over the creation to try to figure out what is this minor orthopedic problem that's going on that I can take care of that. What's this gynecologic problem going on? Maybe I can take care of that. So I did all the extra training so that I could become a more well-rounded physician. I used to work in the insurance world in USF, and I did that for a short period of time, knowing there would be a short period of time. After I transitioned from that into Echelon-Health, we started this practice in 2013. Since then, we have grown slowly but steadily. And the reason we've grown, I think, is that we're able to say, like I said, our patients are our only concern. And the way we show that is we say, we are going to have a membership fee that pays for all of your medical visits for 1 year. Why is that good? That's good because I don't have to worry about you not being able to come see me because of some other constraint. So I find that when patients are able to see you whenever they need to be seen, they get better. No matter what their situation is, they get better. Whether they have a complicated medical situation, whether they have a simple medical situation, whatever it is, I'm able to optimize their health because we can take as much time as necessary to make sure they get better. That is the most important thing to me. I believe our patients their most valuable asset is their health. And the reason I say that is because without your health, you can't produce. Without producing, you can't pay bills or be there for your family. So that's the reason I say a patient's health is their most valuable asset. It's not their house, not their job, not even their degree. Their health is. Because if I have a stroke, my degree is worth nothing, okay? And so that's why I like concierge medicine. The other way we do it is we pass our our ability to access prices that are not available to patients, we pass that along to our patients. In our practice, if you have insurance that pays for your labs, that's fine. We use your insurance to pay for your labs. If there is no coverage by your insurance, then we give you our prices on labs. So our prices are a lot less than what a patient would get if they went and said, I'm a cash pay patient. So for instance, in our practice, labs for a general physical cost about $40 for 5 different labs. So if you took that same panel of labs and gave it to a patient, and then when they went out to the outside doctor, who is a regular insurance-based doctor who doesn't have concierge medicine benefits for their patient, their patient would have to go to the lab and pay cash prices, which could be hundreds of dollars for those same types of labs, probably $400 for a $40 panel. The other thing we do is we give our patients our prices on medications. So if there's a medication that we can get for cheaper than they can get through a pharmacy, sometimes we can, sometimes we can't, we always pass that benefit along to them, particularly with compounding drugs. So for instance, for hormonal treatments, testosterone, things like that, we can get a 3-month supply of testosterone for $39. And we're able to do that because we have utilized our buying power as physicians and pass that savings along to our patient. So what's included with our practice in concierge medicine? Our practice includes a yearly physical, which is 2 hours long. It's blocked for 2 hours. Now, whether or not it takes 2 hours is not important. What we do, though, is we block it for 2 hours. And then if you need to be seen weekly from then on out, we see you weekly. If you only need to be seen every few months, we see you every few months. But we do whatever our patients need. We're certainly not going to drag you in here just to say hi and waste your time. The other thing we can do is to see you when it's convenient for you. So if you're on the weekend and you get bit by a dog, then we'll be able to see you then and maybe even give you a tetanus shot, okay? Save you a trip to emergency room, save you costs, save you time, save you hassle, and give you peace of mind. The other thing we can do is we can see you via technology. So we can see you over video consult. We could see you through text messaging, Skype, however you want to do it. If you're in Colorado and you hurt your knee skiing, then I can video consult with you and see, show me how well you can move your knee and go from there. So we can basically triage you using technology. So that's the overview of what you do, or what we do. And for now, I would like to see if there's any questions that you have about what we do and why we do it. Anybody? Okay.
You pretty much explained it pretty well.
Well, what we do is, yeah, so
Done that before, maybe.
so I think that, for those people out there who need it, we're a very good source for them. For those people who don't need it, certainly we're not there to say everyone needs this type of treatment or needs this type of care. But those who do need it, we are able to provide that level of service at an affordable price and then give them, like I said, as much of our expertise as they need for a yearly fee. And if you think about it, investing in your health, like I said, is investing in your most valuable asset, which is your health. Yes, ma'am.
Is the yearly fee due all at once, or can it be done in installments? Like
The yearly fee? The yearly fee, it's a yearly fee, so we say it's a yearly fee. It's payable in installments.
Okay.
If you'd like to pay it all in one, we discount the price.
Okay.
I have a question. I run, and I have a lot of friends that I run with older than me, and they have to inevitably take time off for injuries like that. I don't know if that's something common that you've dealt with, just kind of common running injuries, and if you've been able to improve that for people, less time off, less time healing.
Well, we'd like to do a kind of ascertain why it is that you have, or what you may have, let's say. Now, may have patients who are feeling completely fine now, but if you look into their future, and the way you look into their future is by looking at their past, not their past necessarily, but the past of their family, you can predict certain things. You can also do testing for certain things that may predispose you to injury. But yeah, we do a lot of preventative. So I would categorize that as preventative medicine. And that's one of the things that we pride ourselves on is preventative medicine and also trying to fine tune. So yeah, that's a great point is we don't want to just fix things that are broke. We want to fix things as they occur or try to prevent them from ever occurring. Well, thank you all very much for coming. And
Things that you do for sports medicine.
for sports medicine, so sports medicine, what we do is, like to do is make sure that patients have, first of all, good physical health. So physical health includes your medications and your, any kind of organ disease, but also physical health includes being physically active. So we always try to encourage our patients to assume some type of level of activity. So sports medicine for me was a way to help patients become healthy through activity. Particularly what we do in sports medicine, what I do a lot of is joint health. And so people who are having problems with joints, we make sure that they're on the proper vitamins if necessary, proper supplements. And then we also are able to do things like injections if needed that will help them maintain or keep up their level of activity. Because the last thing we want is someone who has a bad knee to not exercise because their knee bothers them. We would rather give them Euflexa. And so Euflexa is a joint supplement that you can use to inject, and we can give that to our patients at our cost, which is, I think it's $435 or something like that at last count for 3 injections, whereas the cash price is like $800, $900. So we're able to do that, and the injections are covered by our membership fee. So another thing is our membership fee includes everything. If you fracture your leg, God forbid, and I can fix it, it's non-displaced, then we cast it, we monitor it, we do all the care for included in your membership fee.